Okay, so let me just start my presentation. Okay, so pharmacology is the subject, is a very important subject, as all of you know that, like it is the subject which you are going to practice every day in, day out during your clinical practice. So in this class, I'll try to cover some of the aspects, okay, related to what is drug, what is pharmacology, and some of the branches of pharmacology. And I'll try to see if the sources of drugs can be covered in this. But other informations, I think, like sources of drugs and contributors to pharmacology, all these things are covered in practicals. So we'll see if that can be done in the other classes. Evolution of pharmacology and stages of drug discovery and all, it will not be covered in this class. So now we'll see what are the other things we can cover. Okay, what is pharmacology? So ನಿಮ್ಗೆಲ್ಲ ಗೊತ್ತಿರೋ ಹಂಗೆ what is pharmacology? Pharmacology means, let us see, pharmacology means it is the science of study of drugs. Okay, it's a science related to drugs. So what is drug? Drug means it is the active ingredient which is responsible for some therapeutic benefit. ನಿಮ್ಗೆಲ್ಲ ಗೊತ್ತಿರೋ ಹಂಗೆ pharmacon, so you have let me try to dissect the pharmacology. Pharmacology means it is having two words, okay, pharmacon and logos. So pharmacon means drug, logos means discourse, means it is the study of drugs. Okay, pharmacology means it's a basic question. Usually we will ask, generally we will ask in the viva. First question what we are going to ask is, what is pharmacology? Okay, so pharmacology means it is the study of drugs. Okay, so just to make you understand what are drugs, you will come across this terminology every now and then. Okay, what is drug? Drug means it is an extraneous subject what we generally give for the treatment of particular ailment, or it can be for the purpose of diagnosis of a disease or for preventing a particular disease. Okay, so in the whole pharmacology subject, what you are going to study, you are going to study about the sources of drugs, what are the reactions, how the drug enters into the body, how it goes out, and then how it is metabolized. Like, so there are various branches of pharmacologies are there, like pharmacokinetics and pharmacodynamics, which you are going to study in the near future. So let me try to tell you what is drug. ನಿಮ್ಗೆ ಔಷಧಿ ಅಂದ್ರೆ ಏನು? What is drug? Drug means it is a chemical substance which can produce biological response. Okay, so it is a chemical substance which can produce biological response in the human beings, or it may be in any other living organism. Okay, it need not be affecting only human beings. Even for the veterinary also there are drugs are available. Okay, so like that. So a drug is a substance which can change the functions of the which can alter the physiological function, or it can which can correct the altered physiological function, or which may treat the pathological condition or prevent a pathological condition, that prevent a particular disease or to diagnose a particular disease. Okay, so it's very important for us, like as all of you know, you are going to become doctor, and since you are going to become doctor, you are going to prescribe the drug throughout your life, and for that purpose you need to know each and every drug thoroughly. ಓಕೆ. ಸೊ ನೀವು ಚೆನ್ನಾಗಿ ಕಲ್ತ್ಕೊಂಡಷ್ಟು ಡ್ರಗ್ ಬಗ್ಗೆ, ಔಷಧಿ ಬಗ್ಗೆ ಎಷ್ಟು ಕಲ್ತ್ಕೊಂತೀರಿ ಅಷ್ಟು ನಿಮ್ಗೆ you can very well treat your patients properly. Okay, so it's very important for you to know about the drug. Okay, so it's a single active chemical entity present in medicines that is used for diagnosis, prevention, treatment, or cure of the disease. I'm telling you again and again, because you will always, so moment we ask you what is drug, you will tell, sir, drug means it is the drug it is a chemical used for the purpose of treatment of a disease. Not only that, it is for the diagnosis and also for the treatment and cure of the disease. Okay, so WHO definition. So generally whenever we ask you, we will ask you about WHO definition of drug. Okay, drug is a substance or product that is used or intended to be used to modify or explore physiological systems or pathological state for the benefit of recipient. If you dissect the whole sentence, you can see drug is a substance used or intended to be used either to modify or explore the physiological systems or pathological states for the benefit of the recipient. Okay. Unfortunately, in the society, you must have, before joining MBBS, anyone asked you, are you taking any drug? You would have felt very offended, right now, because it is wrongly used. This terminology is very much abused by the media and society, everyone, but it is not not in the right sense. Okay, so we should try to, you know, take away this misconception from the society by educating the people. Okay, so we should try to do that. Now let us try to understand little bit about the pharmacology, history of pharmacology. Okay, pharmacology is the first subject that is supposed to get birth in this medicine. Okay, so because ಯಾರಿಗಾದ್ರೂ ಈ ಡ್ರಗ್ ಅಂತಂದಿದ ತಕ್ಷಣ ನೋಡಿ, ಯಾವುದೇ ಒಂದು ಡಿಸೀಸ್, ಓಕೆ, ದಟ್ ಈಸ್ ಫೌಂಡ್ ಆನ್ ದಿಸ್ ಅರ್ತ್, ಓಕೆ, if that disease is found, then it should be treated. Okay, so any health problems that occurs to any human being, it means that immediately that requires a treatment, right? Now, so these are diagnosis and the causative agents, all those things came later. Okay, everything came later, but most important thing that came first is the treatment, the disease. That's why it's very important for us to know that. Okay, so drug is the first thing to come into the picture. After that, everything came into the picture. Okay, in the olden days, they used to use crude drugs. Okay, crude drugs like castor oil. You may be knowing, like a castor oil is used for constipation. Okay, so like that, and the copper or directly metals, iron. So like this, they started using, or some plant extracts, or the plant itself, or the root, like this. Okay, so people started using the medicines, like for a snake bite, some herbals they use. Even when I was a kid, at that time my grandmother, suppose if I had any scorpion bite, she used to give me some plant extract and then just mix, or rub it on a stone and take out some medicine and then give it to me. So I used to swallow and then I used to be all right. So the medicines started coming to the picture first, and then later they all evolved out of pharmacology and they became specialized subjects. So medicine, pathology, microbiology, everything started evolving over a period of time. Okay, so that's how the medicine started evolving. Then if as the ages started, as the years kept on moving, when the people started inventing new things. Like 1928, what happened? Fleming is a Scottish microbiologist. He wanted to go on vacation. Okay, he wanted to go on vacation, and he told his friend, please, like, I'm doing some kind of culture of these microorganisms, and then I have a broth, I'll keep it here, and I will go home and then come back. He will go for a vacation for 10-15 days, and he will come back. Then he went off. Then his friend did not take care of anything. He just kept it on a table, and then just he did not do anything, just left it as it is. But after coming back, you can see that like, there was a fungus growth was there. Okay, so in the center, and then there was a completely empty dish. Okay, so there was nothing, nothing was like, no microorganisms were growing beside that. Okay, so only the fungus. So the fungus extract, okay, which is exudating there, and finally no microorganisms were growing in that petri dish. So then suddenly this Alexander Fleming, he realized that some chemical is released from this fungus mold, and that is responsible for inhibition of the growth of the microorganisms. So through this mechanism, he found out there is some chemical that is released by the fungus, that is penicillin. Okay, so that after so many years, now it is 1928. Now we are almost getting to 100 years. 100 years after releasing penicillin, and still penicillin is the one of the most safest and the best medicine available for the purpose of treating various infections. And cephalosporins, monobactam, so many drugs are invented through this invention. Okay, so all of them are having beta lactam rings. Okay, so all these drugs like penicillins came in, and then synthetic penicillins came in, and then cephalosporins came in, monobactams came in, so carbapenems came in. So like this, so many drugs are getting evolved every day in
All my class.
hello. So, so many drugs are getting evolved, released, and they are coming in here. Okay, so in that way, the drugs are getting released day in day out through this invention. That's how I can say that one of the important steps of identifying the drugs came in. And most of the drugs, like, they have the limited efficacy. They are not that one drug I can give and they will do the wonders. No, nothing like that. So every drug has its own goods and bad, so that need to be studied in pharmacology. In the last 150 years, so many purified drugs were identified, chemicals were characterized, and they all getting developed day in day out. And you can see now, if you go to the website, that is FDA, Food and Drug Administration, USA, and many other organizations, you can see that day in day out, every day in day out, new drugs are getting released. So it's very important for us to learn how the drugs are developed, how the drugs are identified, what are the sources of drugs, what are the different branches of pharmacology. All those things you should learn, so that you will have a broader understanding of pharmacology, and you will be able to use these drugs better. Okay, so and also, like, once you identify the drug, what you need to do, you need to evaluate its pharmacokinetics and pharmacodynamics. Okay, so I'll come to these terminologies very soon. So every drug has its own mechanism of action. Okay, that is what you are going to study throughout your pharmacology career. Okay, so mechanism of actions, so how the organ functions are affected, how the cellular functions are affected, how the all these cellular functions and the intrinsic mechanisms inside the cell, how they are going to change the therapeutic outcome, what is the rationality of this. All these things you are going to learn from this. So one more invention you can see here, sulfur drugs. Okay, that is again 1932. So those days prontosil. Okay, prontosil is the one dye. Okay, it is a dye, and they learned that this dye can be applied over the ulcers and other things, and by consuming this, so some of the bacteria can be killed. Okay, so prontosil had it is a sulfonamide group of drug, and it was identified, and this dye was initially used, and then they found that they can cure some of the important yeah, streptococcal infections, and it is having antibacterial activity. So like this, now even today, even today, this sulfur drug is available, okay, as cotrimoxazole. Okay, as cotrimoxazole, it is still available, and since it is not used for its own adverse drug reactions, but it has become a very important drug, because whenever other drugs are not useful, at that time sulfur drug can be easily used, okay, for treating some of the infections, especially urinary tract infections, and then typhoid. So like this, important infections can be treated with this. Now I am going to talk about two important divisions of pharmacology, that is pharmacodynamics and pharmacokinetics. Now you may be wondering, what is this dynamics and kinetics? If you know, kinetics means what? Movement of the thing. What is that movement? It is the movement of the drug. So where it is going to move? It is moving inside the body, right? Now, so it is easy for you to, suppose if I ask you what is pharmacokinetics, pharmacokinetics means movement of the drug, where it is moving inside the body. Okay, it means that, so the our body is going to modify this drug. Okay, so what the body does to this drug, okay, it is called as pharmacokinetics. Okay, so dynamics means what? See, why we are taking the drug? It is having some power. Okay, so dynamite, it is a powerful thing, right? Now, so like that, dynamics means it is a power of the drug. Okay, so let me try to introduce these terminologies. Now let us see. Okay, pharmacodynamics. Dynamics means power of the drug. Okay, who is having the power? The drug is having the power. That is why we are giving the drug to the patient. Okay, so that it can, with this power, it will treat the patient. Okay, so it means that, okay, so now it is easy. Like if I ask you what is pharmacodynamics, then you should tell that it is the what the drug does to the body. What it will do once it goes to the body, either it will alter the physiological functions, either it will increase the heart rate, or it will reduce the heart rate, or it will increase the gastric secretion, or it decreases the gastric secretions, or it increases the preparation of urine inside the body, or that is the, it's a formation of urine is increased, or it is decreased, or it increases the insulin secretion, or decreases the insulin secretion, like that. Okay, the drug will have its own power, so it will execute that power. Okay, so you can see here, the once the drug is taken, it may affect from the top to bottom, maybe from the hair to the brain, to the vessels, to heart, or to skin, or to any functions in the GIT, or the ovarian, or testis, or the dynamics of blood flow throughout the body. Okay, so like this, it can impact the whole body. Okay, so all these things, how the drug affects the cell, affects the body, affect the organs, affect the physiological functions, or affects the block, like, if I am doing some diagnostic tests, like if I take one drug like barium meal, okay, if I take barium meal, then it is going to it is in opaque, okay, so X-ray opaque. Then if I take an X-ray, then it will show the movement of the this barium meal. And if I do the series of if I do the series of X-rays, then I will know how it is moving from top to bottom. Okay, so then in that way I'll be able to identify any defects or any congenital anomalies. All these things I can do. Okay, I can identify. Nowadays we have advanced things like endoscopy and all those things. When we were students like you, we did not had all these things. Okay, so in that way we are able to we could not do anything much, but now we have many dyes are available, many like techniques are available, X-ray technology, all these things are available. So in that way, so actually, like it is showing 10 more minutes are there. But what I will do immediately after the end of this meeting, I will again share one more link in the group. Okay, so you can very well join so that we can continue the discussion for next some more time, so that I will cover some of the important portions. Okay, so let me continue my class now here. Okay, suppose if it ends, then I will again share one more link so you can join. Okay, so every 40 minutes generally it ends, so it's a free version, no, that's why it is like that. So you can join again so that we can continue for some more time, so that we'll cover some more topic, and then we will continue in the next class. Okay, so next is pharmacodynamics. You can see it will alter the effects on physiology, also biochemical, organ functions, subcellular or cellular, molecular level changes, like this. Okay, so adrenaline, it affects the alpha or beta receptors, then it goes and affects the G protein coupled receptor. It increases the adenyl cyclase activity and AMP secretion, increases the intracellular cyclic AMP, and then increases the cardiac functions or stimulates the cardiac functions, hepatic. So all these things are getting affected. Okay, so like this, so we will learn about each and every topic over a period of time. Now it is pharmacokinetics. What is pharmacokinetics? Pharmacokinetics means it is the movement. Kinesis means movement of the drug. Where the drug is moving, it is moving inside the body. So it enters into the body, it gets modified like absorption, distribution, binding to the or to the plasma proteins, or localization or storage inside the fat molecules or in the bones, and then it gets metabolized, biotransformed. Okay, so don't get confused, what is metabolism, what is biotransformation, both are same. Okay, you may get a question discuss the metabolism of the drug or biotransformation of the drug. So it is same. Okay, biotransformation or excretion of the drug. Okay, so it's in a very simple word, pharmacokinetics means it is the absorption, distribution, binding, localization, storage, biotransformation and excretion of the drug. Okay, in simple words, so it is the ADME. Okay, so it is the absorption, distribution, metabolism and excretion. Okay, so all these things are discussed in pharmacokinetics. Okay, so you understood now. So what is pharmacokinetics? Pharmacokinetics means what the body does to the drug. What the body does, it absorbs, it distributes, it binds or localizes, then it gets stored or it gets metabolized or it gets excreted. So in pharmacokinetics, you will understand what are the different factors that affects the pharmacokinetics. Okay, in pharmacodynamics, you will understand where the drug will bind, where it is going to affect, what it is going to do, and how it is going to modify, and which are all the organs that are going to affect it, and what are the receptors that are responsible for it, and what are the adverse effects, what are the good effects, bad effects, everything we are going to discuss in pharmacodynamics. Now you can see an example, paracetamol. It is rapidly, completely absorbed in orally, and peak plasma concentration achieves at 30 to 60 minutes, and it is bound to plasma proteins and widely distributed. Volume of distribution is 1 liter per kg, and extensively metabolized in liver. Glucuronidation happens, sulfate conjugation happens, then inactive metabolite is prepared and excreted in urine. So it takes 50% of the drug from the body comes out in 2 to 3 hours. So like this continues. Clearance is 5 ml. So like this, various parameters we are going to study. So how are you guys? All of you are able to understand? So should I continue? Anyone? Okay, you can mute yourself now and let me have some feedback session, how you people are enjoying. Hello? Can you, any of you are able to follow what I'm saying? You can unmute yourself. Who is this? Neha, Anu, Harshal, all of you are there? Akshay?
Yes, sir. Yes, sir.
Okay, you can unmute yourself. You just speak. Let me, spend few more minutes. And do you think that we should continue in the next 40 minutes, or we can wind up today and then continue maybe some other time? What do you think? How are you guys? Anyone from odd batch? Akshay Gowda, Anu, Neha, Sanjana, Shashank, Ujjal.
Yes, sir.
Just open yourself, open. I want to speak to you people. How are you guys? Are you able to follow? What are you? You are able to follow what you are seeing? You are able to understand what I am discussing. Just unmute yourself. All of you, unmute yourself. Let me just understand. It should not be one way, okay? Because it's an extra class. You people should speak, okay? I understand. Let me understand what you people are trying to do. Just speak out, no? Don't get, don't be hesitant, okay? It's Shashank, tell me. ಕನ್ನಡದಲ್ಲಿ ಹೇಳಿ ಪರವಾಗಿಲ್ಲ, ಏನ್ ತೊಂದರೆ ಇಲ್ಲ. ಯಾರನ್ನು ಇಂಜರ್ ಕೆಟ್ಕೋಬೇಡಿ. ಏನಾಗ ನಾನೇನ್ ಬೇಜಾರು ಮಾಡ್ಕೊಳ್ಳಲ್ಲ ಕನ್ನಡದಲ್ಲಿ. ಐ ವಿಲ್ ಬಿ ವೆರಿ ಹ್ಯಾಪಿ. ಹೇಳಪ್ಪ, ಮಾತಾಡಿ. ಸಂಜನಾ ಮಾತಾಡಿಪ್ಪ, ಎಲ್ಲಾರು ಒಬ್ರು. ಶ್ರದ್ಧಾ.
Sir, could you please repeat the question, sir?
Who is this? Shashank?
Shashank, sir.
Yes, sir.
Shashank, ನಾನು ಏನ್ ಹೇಳ್ತಾ ಇದ್ದೀನಿ ಅಂದ್ರೆ, whether you are able to follow or not what I'm discussing. Are you finding it interesting? Do you want me to change the pace, or am I fast? Am I slow? Can I go fast?
No, sir. No, sir.
No, sir. I'm following it.
You are following? You are
I'm
happy?
following it, sir.
Okay, because this session is like it's a private account. Only 40 minutes it allows. Okay. So if you people want to continue, then I will end this call and again share the link. You can again join.
Okay, sir. Okay, sir.
So do you think that we should continue, or we'll continue in the next class? I only just opened up because it's only initial first class, no? So that I want to give the basics very slowly. Once you people are up, then I can go a little bit faster. Hello? Okay. So now it is almost 40 minutes. It is continuing. All of you are there online?
Sir, dinner time, sir.
It is dinner, na? Okay. So we
Yes,
will
sir.
come back again I will announce the next class later. Okay, I will end the class now. Okay. Okay, all the best. We'll again meet later.
Thank you,
Thank
sir.
you, sir.
Okay, bye.